Hi, Phil Borders from Hendricks Therapy. Today we're going to touch on PTSD, post-traumatic stress disorder. This is a massive topic, but we're just going to spend a couple minutes just to kind of look at it a little bit differently, and one thing that you can do to help yourself if you do have PTSD. So PTSD, post-traumatic stress disorder, obviously comes after a stressor. And if you think about it, a lot of the symptoms are positive if you're still in that dangerous environment. So if you're in an abusive, dangerous environment, it's good to be watchful. It's good to be avoidant. It's good to be fearful. But once you get out of that environment, a lot of those same characteristics, those same defenses that worked in those environments are now counterproductive. So ask yourself, if you're listening to your PTSD self, that, was very helpful, effective, and kept you safe, or if you're now listening to your older, wiser self that doesn't need that protection anymore. Without really disregarding or disrespecting the PTSD self that some of us have who have been through significant trauma. And one way to get over PTSD is to differentiate between the PTSD self talking, the wise self talking, and to not engage in avoidance. So part of PTSD, one of the big harmful aspects of PTSD is avoidance, where you avoid going this place, you avoid doing that thing that's associated with the traumatic event, but it's no longer a traumatic event. And study after study has shown that non-avoidance, although incredibly difficult, is probably the best thing to overcome PTSD. And when you go somewhere and it reminds you of a traumatic incident, but you go anyway, you give yourself a big pat on the back for the courage you just displayed, because you just won that battle. Phil Borders, Hendricks Therapy, thanks again for your time.